I'm allowed to have projection is not my fault. Okay. We good? Okay. Welcome, everyone. I'm Debbie Krause. My pronouns are she, her, and I'm the library's community engagement coordinator. On behalf of the Niagara-on-the-Lake Public Library, I'd like to welcome you all here for the very first of hopefully many exciting, informative, and titillating evenings to come. As community engagement coordinator, I aspire to partner with many different organizations in the region. It brings so many more voices, experiences, and therefore ideas to the table. I've enjoyed every meeting we've had while putting this together. I've been educated on subjects that made me blush. My world has been stretched, and I have been awed by the energy and grit of all who have worked so hard to organize this series. Thank you for that. Some quick logistics before I hand it over to Sarah. Washrooms are behind you, down the hall to the right. As you may have noticed, we are currently still open to the public. This model has worked really well in the past, as there is mutual respect between those using the library and us in the program. You do need to know that the doors to the outside will lock at 8 o'clock automatically, so if you do need to go out for something, that's fine, but let somebody else know that you are leaving and you would like to come back, because they'll have to trigger the doors for you. And finally, I'd like to acknowledge my colleague, Sarah Bowers, who has relatively recently stepped into the role of Technical Services Coordinator and the unenviable task of figuring out how to put together a quality hybrid program. This would not be happening without her persistence and willingness to learn and try and try and try. Yay. All right, that's it for me, so I'm going to pass the mic over to Sarah.
Hi, I am Sarah Burch. Pronouns are she, her. I'm with Positive Living Niagara, and I'm really excited to be here this evening. Before we get started, I just want to begin with a land acknowledgement. We start with a land acknowledgement to remind ourselves and center ourselves before we think about, as I'm giving the land acknowledgement, where we sit in these conversations. So we acknowledge the land upon which we gather as the shared traditional territory of the Haudenosaunee and Anishinaabe peoples, protected by the dish with one spoon wampum belt. This historic peace agreement between the Iroquois Confederacy, the Ojibwe, and allied nations represent a commitment to share and protect the land, water, plants, and animals with respect. We wish to honor the original peoples of this land and express gratitude for the opportunity and privilege to work with communities across this territory. I come to this as a white settler. I'm actually not originally, as we talked about earlier, I'm not originally from the Niagara region. I grew up in Sault Ste. Marie, just down the street from the Algoma University, which growing up all my life, it's something that I drove past every day, had dance recitals in, had family members who worked there, but the history of that actual building was hidden from me. It wasn't until just only in the last few years that I realized that actually is this building that holds so many fond memories for me growing up actually used to be a residential school, something I didn't know anything about. So it's really important, this process of unlearning all these things that have such different meaning for me, really stood as a monument of colonialism and trauma for a lot of folks. So, and that's something that I've had to unlearn. And hopefully today, also as we go through this process, there'll also be a process of unlearning and relearning as well. So on that note, I'm going to pass that over to our lovely, wonderful, incredibly, just amazing human beings, Celeste and Stephanie, who will be sharing their knowledge.
Yeah, thanks, Sarah. I'm Celeste. I use they, them pronouns. I'm the LGBTQ2 plus support coordinator for the Niagara Falls Community Health Center. I also would like to acknowledge that I'm a settler to this land. My heritage is of European descent. Both sides of my family, one side was farmers, the other side worked more so in construction. And both of those opportunities for my families directly came from working with and on and from stolen lands. And so I want to acknowledge that's grown a lot of privilege for my family and for myself, and really has even led me to being right here today with the experience that I have. So yeah, acknowledging that, and also that this month is Pride Month, it's June, but also that it's Indigenous History Month. Yesterday was also a big day for celebrating Indigenous identity and culture on June 21st. So yeah, I want to acknowledge those things.
Hi, you can hear me okay? I have like a very soft, a soft voice. I'm Stephanie Vail. I use she, her pronouns, and I'm from Quest Community Health Center with our Rainbow Niagara 2S LGBTQ plus services. And I have a couple of notes here in terms of land acknowledgement. So as a settler on this land, I am committed to ongoing learning about Indigenous history and experiences through the arts. So I try to do a lot of reading, of Indigenous authors, and listen to music and sort of incorporate visual art to my life. And I'm also, trying to ongoingly dismantle systems of oppression, including like patriarchy and capitalism and colonialism and racism. And as Indigenous folks who try to access healthcare, including the Two-Spirit community, there's often a lot of discrimination and violence in services that are not safe. So I just I try to do a lot of reflection in terms of the care that I provide and the care that our center provides, because I think it's ongoing work that we need to do and be reflective. So those are my thoughts.
Yeah, that's great. Thanks, Steph. In this image, I know it may or may not be super legible depending on your eyesight and the live stream, and I know the slides will be posted online after, but I just want to acknowledge that this is from Illuminative's Instagram page, and that this photo is by Nate Lemuel from Dark Listed Photography, and it says, "Let's not forget you're celebrating pride on stolen land."
So we're gonna do this.
Yeah.
Celeste and I, so we have a PowerPoint created for tonight, and we're excuse me, we're also hoping that tonight will really be like a conversation to talk about sort of how we can move from allyship to Accomplice in terms of trans inclusion and trans healthcare. That's what we're talking about tonight.
Yeah, totally. I think a lot of times when people think like, of course I'm an ally, sometimes the standard is like, because I don't hate you. Which is not great. that is great. Thanks for not hating us. And right, that being an ally though is more than that. That ally, I like to think of it as a verb, and I like the word accomplice for that reason. That is like not just that I passively don't hate you, but also I'm with you on this journey, and that I also want good things to happen. I want things to move forward and progress in a good way. So yeah,
it's almost like I see it as walking with someone.
Yeah.
And advocating alongside them, right? As opposed to, like, I don't know, when we look at allyship, I think that there's so many wonderful things in terms of being an ally, but I think it ought to be more than that.
Totally.
Right? So,
yeah.
Anyways, here we go. So we do have a content warning in terms of there's going to be mention of suicide, mental health challenges, abuse, harassment, and we just encourage people to do what you need to do to take care of yourself during this time together. So whatever that looks like, we want to encourage you to do that. And also to not share identifying details if we're going to discuss personal stories. So we just wanted to make sure that people are aware of that.
Mm-hmm. Mm-hmm.
I don't know if you have anything to add to that.
Yeah, well, I'll give you an example in case that's confusing. So sometimes, I'm sure you experience this too in doing talks, someone will be like, well, my cousin James used to be Jessica. And I'm like, oh no, don't do that. Don't give out a lot of details about people unless you are 110% sure that they would be okay with you disclosing that information. And I know people like to share stories to show like their own experience, and you can share those stories, but leave out the identifying piece pieces, right? She's like, someone I know may or may not be my cousin. Leave out the names, right? Like just to keep folks anonymous in your story sharing.
And to keep people safe, right?
To keep people safe,
Right.
absolutely.
Awesome. Great example.
Thanks. So tonight we're going to talk about there certainly is a desperate need for trans-affirming healthcare I would say in the world, but especially in Canada, especially in Ontario, and especially in Niagara. And so what this graph shows, this is from TransPulse Canada. This came out in January 2020. And again, I know this may or may not be super legible on your screens, but I will explain it to you. So what this graph shows on the left is what percentage of people have a primary healthcare provider. So the magenta color is the trans and non-binary population, and the other columns that are purple and white lines are the general population. So 81% of trans and non-binary folks have a primary healthcare provider, and 84% of the general population have a primary healthcare provider. So there's a 3% difference, not a huge difference, pretty good. When we look at the next column, though, it says who had a past year unmet healthcare need. So in the magenta, 45% of trans and non-binary people had an unmet healthcare need in the past year versus only 4% of the general population. So a much bigger difference than 3% that we saw in the last column. And I think that really speaks to the fact that, primary healthcare providers are not always trained in providing trans-affirming care, gender-affirming care, and even LGBTQ2 plus health in general, and competence around that, and that there's a lot of room for growth, if I'm being kind, and education needed to bridge that gap. Another stat that's shared here, this is also from TransPulse Canada, is that trans and non-binary folks in this study, 12% had avoided going to the emergency room in the past year despite needing care. So it's one thing to not get the care you need on a regular basis, but to also literally be in an emergency needing prompt attention medically and avoiding it because of fears around, well, Steph's going to talk about that actually.
Or past experiences.
Past experiences.
That were really negative and, discriminatory or included, misgendering and...
Yeah.
Anyways.
Yeah.
We're moving on here.
Mm-hmm.
So why? So we're going to start talking about the why. So we sort of touched upon negative experiences and mistreatment. So many people who access care have had negative experiences, including discomfort, denial of care, and discrimination. And this happens in all levels of healthcare. And 50% of these individuals, and this comes from Rainbow Health Ontario, which is an Ontario-wide agency that focuses on LGBTQ2S+ health. So 50% were not comfortable discussing trans issues with their doctor. So once again, looking at past experiences, people are not comfortable, even bringing, these issues up with their doctor. And 30 to 40% perceive their physician to be not at all knowledgeable about trans health issues. Feel free to jump in, of course.
Yeah, for sure.
20% have been denied hormone prescriptions. 20% and 21% have avoided emergency room care because they perceive their trans status would negatively affect the encounter.
Yeah, so this is a different research poll from the last one that said 12%. That's why there's the asterisks, but I think either way, it's important to talk about these numbers.
Yeah.
Mm-hmm.
Yeah, so there's a lot that happens, to folks when they're just like simply going to emergency department to try to access, any sort of healthcare, whether that's like trans related or not. Trans folks have the same health needs, as non-trans folks. And 11% have obtained hormones from non-medical sources. So that's often looking, online or other ways to access, life-saving trans care.
Yeah. Yeah, and there's a safety risk involved in that too, right? Mm-hmm. Mm-hmm.
This is me, right? Yeah. We're continuing. Sure. So why the why? So many whys. Why the why? So providing trans-affirming and to us LGBTQ+, competent care in general is not mandatory learning. So it's not something that's actually required for individuals. And we're talking about medical, like we're talking about primary care. Yep. It's not actually discussed in any formal healthcare educational programs. So what actually happens is providers must seek their own knowledge, so must seek training on their own accord, which in Ontario, we actually have some pretty great resources in terms of trainings. Rainbow Health Ontario is a big one that offers just really wonderful trainings that are, folks who are physicians can access their, what are those things called?
Modules, maybe, or trainings.
They get hours for their.
Oh, yeah. I do, like continuing education credits or something.
Like C something. There's some letters.
CEPs,
there.
maybe? Yeah. We are both not doctors.
You might be able to tell.
In case that wasn't obvious. We would be failing at our continuing education credits if so.
Although we would have a lot of education.
It's true. We would have a lot of education.
Okay.
Yeah.
Anyways.
Yeah. And those trainings, it's great because Rainbow Health Ontario now, they're available online. You don't even have to go to Toronto to access them. And I think the most expensive one is $40. Like they're quite accessible now, especially. And so it just, folks have to take that on. They have to want to learn that information.
But there is so much available, like
so
from,
much.
Primary care to like providing, mental health supports. Like there is just like wide variety of training resources.
Yeah, even right down to like making sure your receptionists are safe and affirming in the language they use. All kinds of training. So Steph, actually, you had already said once that this is life-saving treatment, and so we just have some numbers, I guess, to back that. So this is from TransPulse in 2010. 433 trans folks were surveyed across Ontario, age 16 and older. And here's the mentions of suicide. Had found extremely high rates of suicidal ideation and suicide attempt. So what this first graph is showing, and again, I know this is kind of tiny, but is what percentage of populations had had a suicide attempt ever in their life. And when we look at trans Ontarians, 46% had had a suicide attempt at some point in their lifetime. Versus only 3.82% of cisgender Canadians. Cisgender means that someone's gender identity is the same as what was their sex as assigned at birth. And so further to that too, what this graph shows is based on what point someone is at in their medical transition, what percentage of them had had a suicide attempt in the past year. And so medical transition, that might be hormone replacement therapy, it might not be. It might be accessing surgery, it might not be. It might be accessing multiple surgeries or any combination of those things. And another important thing to note is that this graph has the word completed at the end there. And important to know that completed is up to that person to decide that they are complete with their medical transition. It's not up to society to say, here's 5 boxes to check them, and now you're a full trans person. That's not how it works. It's up to folks to determine what is completed to them or what they need to be their healthiest, most authentic selves. So if a trans person was not planning to pursue medical transition, 3% had had a suicide attempt in the past year. If someone was planning but had not started their medical transition yet, 27% had had a suicide attempt in the past year. And then once someone's medical transition is in process, that number goes down to 18% had attempted suicide in the past year. And once someone reaches completed, and again, whatever completed means for them, that number goes down to 1%. So it really is life-saving care. It's really important that folks can access it when they need to access it. That 27%, it's not laziness, it's not procrastination. It can be a number of things. It can be that they're on a wait list for 2 years. It can be that that service just isn't actually available in their area. That's not uncommon. They could have a doctor who's like, I don't know what that is, bye, and doesn't want to pursue that, and they don't think that they can access care. OHIP covers the costs of some things, but not all things. Or even if it does cover the cost, there are other costs associated. They might live in a place that's not safe and accessible for them to access the care that they need and to continue to live under that roof with that care. All kinds of things. Do you want to add anything?
No, I think that was great. I just think it's, when we look at these numbers, they're quite alarming, and I think, I don't know, maybe not alarming to to folks like who are in this work. I don't
Right.
know.
Yeah.
But I know that for some, it can be quite shocking, but this is the reality, right?
Mm-hmm.
And
Mm-hmm. Yeah, definitely. Yeah. And I think, and I've noticed that more and more in working with other folks. Carrie Goring, co-chair of Out Niagara, and I were tabling at an event on the weekend. And we had a couple of people come up and tell us about their bad healthcare experiences in Niagara. And I was like, oh, yeah. Oh, I bet it was this doctor. Yep. Figures. Like, I was just like, oh, yeah, heard it before. Carrie was mortified. Carrie's experience with healthcare, she'll tell you, is a lot of with Toronto. And she's like, I know people at Toronto that just need care and they get it. Like, weird. Great. That's awesome. Not always the case in Niagara. Or not as easily accessible anyways in Niagara. And so, often not the case. Yeah. And so it was interesting to see like how polar opposite our reactions were. Like I was so not shocked. I could guess what doctor they were talking about based on what they were telling me about their negative experience. And Carrie was floored by that. So yeah, very interesting. Mm-hmm.
So we're going to talk a little bit. So we've touched upon Niagara, and so this information is from the Out Niagara Community Needs Assessment report. So yeah, our question is it that bad in Niagara? So as we were just talking about...
Spoiler alert. It is. Sorry.
There is a lack, this might be shocking to you, there is a lack of general practitioners and affordable counselors in the region. And an even greater gap in practitioners who are knowledgeable and supportive of 2S LGBTQIA plus health. So not a shocker after what we just talked about, but this is the truth.
Yep.
And there's a lot of like discrimination and stigma and ignorance and violence, that happens across family health and in urgent care, or, emergency care, hospital care, including, things like physiotherapy, massage, dental, like anything, right? Chiropractic.
Yeah.
In particular for trans individuals.
Yes. Yeah. Yep.
And so community members experience healthcare providers' refusal as well to take on 2S LGBTQIA plus patients, and there can be dead naming, there can be misgendering, fat shaming, poor shaming, heteronormative assumptions about people's sexual health, birth control, family planning. So this is what's happening in Niagara, and I don't know if you wanted to speak any more to the community needs assessment at all, or
Sure.
like anything like that I've touched upon here?
Yeah, and there's a couple more slides around the community strengths and needs assessment, but the community strengths and needs assessment was done by Out Niagara. We received funding from Women in Gender Equality Canada to do that. We had 400 and something. It's on a slide. It's coming. 400 and something responses to our survey. Yeah, you want to jump forward? Maybe 438 responses from the region of Niagara, which is really good considering our population, is what our consultants told us. There was another largely populated region that did a similar project, and we got more responses than that region, which is cool. And great, and I think speaks to like the need of Niagara's community to be heard, right? We're like, please listen to us, and did this survey. And we also did like community consultations, arts-based workshops, key informant interviews, and the report's live on our website. Now, all of these links or all of these slides have a hyperlink to whatever the information on the slide is referring to. So if you go to outniagara.org/community-report, that's where the report lives. Thanks. Mm-hmm.
It's really exciting stuff that's happening out of this report.
Mm-hmm.
I will say.
Yeah, thanks. Yeah, it is exciting.
So there's also a real lack of physicians. I think we've touched upon this before, but willing and trained to provide trans care. So the wait lists in Niagara are long. Right now there are no providers in Niagara who provide trans care to people under 16. So that's like a huge challenge.
There's one doctor, and I'm not allowed to say their name because they're not taking new patients, so I can't talk about that. There's one. Yeah, they're really nice, but they're not taking new patients, so it's also not an option.
They are
But
providing. They were, or they.
they do
They
have
do.
patients
Okay.
that they provide care to, but
Okay.
are under 16.
Once again, it's just like hard to access
And-
this information too, right?
Totally.
Or-
Like you and I know that because we're service providers, but
Yeah.
otherwise you wouldn't know that unless that person happens to be your doctor, right? My understanding right now in Niagara, if you're a young person who needs puberty suppression, what you need to actually be able to access that, if that one doctor does not happen to be your doctor, which probably not, you need a doctor or nurse practitioner to support you to send a referral to McMaster's Gender Clinic or Endocrinology Clinic, and the wait list last time I checked is at least 18 months.
That's my understanding too.
Yeah.
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 Or sick kids in Toronto.
Sick kids in Toronto, yep. And there's a couple of pediatricians, like there's one in Waterdown, like some like other right, yeah, a couple, right, yeah, right. Which this is how excited we are about one more person offering this care because it's so few and far between. And this is puberty suppression, something that is like imminent, coming soon. We need to do something about this. Okay, hurry up and wait 18 months. A lot. I mean, if anyone has kids or you know about kids, like they can change a lot in 18 months, especially around that age. So yeah, really, really unfortunate that's not more available.
I mean, I will say right now, like at Quest, our wait list for trans care, so that would be 16 and up, is not too long. I think it's around 4 months to get someone in. So it's not that bad right now, but there are times, there are, certain years where we have actually had to, like we've had a couple year wait. So I think it just depends on where we're at.
Totally. Demand, how many providers do you have that are doing it? Mm-hmm. Yeah.
So this is a quote from a community member expressing their frustration in delays of gender affirming surgeries that are deemed unnecessary. It's speaking to, so it says gender transition support is not available for my 13-year-old. So we were referred to Ron Joyce, which my understanding is McMaster, and have been waiting for 6 months without any word of when the first appointment will be. And my understanding is, 12 to 18 months.
Right.
Yeah. So if you think about just people's age and where they're at developmentally and what happens when we have to wait. And then even within the few healthcare centers in Niagara that provide trans care, experiences vary. So some people may have wonderful experiences and others describe real negative experiences and having to do a lot of self-advocacy to get the healthcare they need, which is just not how it should be.
Totally.
Exhausting. And
very exhausting. Yeah.
That work needs to be on the healthcare provider, not the individual.
To be like, great, I finally have surpassed this barrier. I have a provider who will provide this care, and then you go in the office and you have to fight for it. It's I'm
horrible.
sure just disheartening.
Yeah.
So a couple more points. So from the community strengths and needs assessment, close to half, 243 out of the 438, reported that the biggest challenge they face was naming issues related to health, and that was the biggest issue reported for 2S LGBTQIA plus communities in the Niagara region. And as Steph said, there's long wait lists due to limited providers. And it's funny when I say to people, I'm like, the wait list is only 4 months. That's great. And people are like, that's great. I'm like, yes, that actually is. It's not great, but it's like based on our standards or what we're used to, where it has been a 1 year, 2 year wait list in the past, or just not available, or having to travel out of region, or all kinds of other things where I'm like, yay, only 4 months. Speaks to that, right?
Like most people, when they're sort of at that point where they're wanting to access trans care, there's usually been like years, right? Where someone has struggled and someone has, so I don't know, just adding that to the time. So important point.
Yeah. Here's another quote. This is from a parent of a youth. These kinds of trans health wait lists cause untold physical and mental harm to gender diverse people who are already at high risk of self-harm and suicide. And I think the graphs and things we looked at earlier kind of pointed to that already, but here it is confirmed by a parent in Niagara.
So what is next? What do we do?
Now that we've got you very sad about trans healthcare.
Where's the tissue?
Now what?
So what can we do? What can we do?
Yeah, good question. We're trying. You're like, I'm gonna drink my water. What can you do, and what can folks do as accomplices? Right? Again, not allies, and not just allies. I mean, and there are really awesome examples of allies that exist in the region for sure. But yeah, like what can you do as an accomplice? Like we're on this journey together. You might be someone who's cisgender, someone who does not need to access trans affirming care, but you are like, wow, trans people should be able to get the care they need. How do you walk alongside them in a meaningful way?
I mean, they should be able to get the care they need at the time they need it.
Right.
Right?
Yep.
I think that's a critical piece, right?
Right. As simply, as any other healthcare need is addressed, that also that should be, right? Mm-hmm. Mm-hmm.
So we came up with some ideas.
Mm-hmm. Yeah. And if folks here have ideas, we're happy to hear them. Or folks on the chat, somebody's watching the chat function, I think. Yeah, if you're online and you have ideas that you want to share, that's an option too. And so, yeah.
We can start by giving a few thoughts. So first thought was advocating for the Gender Affirming Healthcare Act to improve gender affirming healthcare in Ontario. Mm-hmm. So if this act was passed, the Gender Affirming Healthcare Advisory Committee would mandate the Ontario Ministry of Health to strike a provincial advisory committee. And this committee would include both members of trans and gender diverse community as well as gender affirming healthcare providers to make recommendations to the Minister of Health for improving access to and coverage for gender affirming healthcare in Ontario. Mm-hmm. So that would look at, I mean, we were talking before about it's very limited in Ontario in terms of surgeries that are covered, gender affirming surgeries that are covered by OHIP, and the process is like unbelievably lengthy and 1,000,001 requirements that are often ridiculous.
Yes. Yeah, you need two providers to prove you need this thing, right? Often, so for some things, not everything, but for some things, you need two assessments. And even if you have a provider that's like, yep, you should have this surgery, it's not just OHIP pays for it. It's then your provider has to ask OHIP to pay for it. They have to send in a request, wait for the government to turn it around and flip it back, and hopefully have approved it or not. And then there's more process. But yeah, it's not even just that, yes, it's covered. Great. Go ahead. And you need to get approval and you need to request it. And I've had those take up to a year. I've had those take 2 weeks. And right now I would say I know people that are waiting from November still that haven't heard back. Are you experiencing?
I think that's normal. Yeah. I mean, I think with COVID too, I think it has definitely put things back as well in terms of surgeries. Mm-hmm. But it's also looking at what is covered, right?
Yeah, not everything.
It's really limited, right, in terms of what is covered. So anyways, this act could be amazing, would be amazing.
Right. Absolutely.
That's our one thought.
Yeah, for sure, right? And this makes me think like top down, right? Here we are kind of on the floor, ground level, being like having these conversations is so good and important. And then how do we affect change from all angles, right? And so I think this is an important one. And I mean, this I think would help with like, we talked about how this isn't part of school. This isn't even part of like becoming a doctor, becoming a nurse practitioner, a nurse, a PSW, receptionist, any part of healthcare. You don't have to learn about 2S LGBTQ plus affirming health. I saw in the news recently that a school in New York actually has a course for it now. And it was like in the news because that's a big deal. Yay, this is being offered now.
What level of education?
Post-secondary. Yeah. Mm-hmm. Like 2S LGBTQ health course. That's a big deal and exciting that somebody's doing that. Yay. But I don't know if it's mandatory though. I didn't read the article the whole way through, but yeah, then I think this kind of thing would be good also in making those pushes and those movements that if you are an accredited school or an accredited program, you have to talk about these things, put it in the curriculum, make people learn about it. It's right now, there's this big kind of separation that like trans care is like a specialty or trans care is a thing you need to pursue where we know trans care is care, trans care is healthcare. Providers provide gender affirming care to cisgender people all the time, right? There are other reasons people need hormones and other things that, people get prescribed, similar with surgeries and things too, that are not trans care, but are so much more easily accessible than what trans care is. And so I think, it needs to be moved away from a specialty and just be part of care, part of healthcare is trans care.
Like, once again, not a medical provider. Gonna state that right now, but my understanding is that, you know, hormones, like we were talking about, hormones are prescribed to people for many reasons, and they're not actually that difficult to monitor and prescribe, right? So I don't know, just sort of thinking about that.
Yeah. A nurse practitioner. Oh, go ahead.
No,
a nurse practitioner that I worked with used to tell me that trans care was the easiest and best and most rewarding care that she could provide, because she's like, it's not complicated to learn. My patients come to those appointments. They almost never no-show, and it's happy things when they come. It's not just like, oh, you're diabetic, or oh, this other hard healthcare thing that they often deal with all their other appointments, but like that these were really exciting things. You have a thing from online? Oh, a question from online. Great. Thanks.
Okay. So our question from online is, are there existing strategies for working with existing physicians within Niagara to be more open to gender diverse patients?
Repeat it again. Are there existing...
Are there strategies for working with existing physicians within Niagara to be more open to gender diverse patients? So what are we doing to get better health?
Yeah, I mean, I think we're going to touch upon like education in a minute, but I think if this is sort of what we're talking about, like I know at Quest, we as an agency, our primary care staff who offer trans care are able to like consult and assist other primary care folks who are wanting to take on some of this work and or wanting to, you know, do more of this work. If that answers the question. So, yeah, like we can be a resource and a support for people, because I know, like for instance, I know I've heard of many doctors who are like, I want to offer trans care. Like maybe this is an example too. I'm sorry, I kind of ramble, but like I think of like I think about Quest, and we offer, you know, a lot of the trans care, I think, in the region. And so say we like initiate someone's trans care, but then a family physician could continue that, right? So that like I guess there's different ways, but there's not any formal, if that's the question, if I'm answering.
Sure. Yeah. I mean, I'll share my thoughts too, like around advocacy and working with physicians locally. You know, it's challenging. Like I'll help people navigate healthcare systems and find family provider if NFCHC is not accepting new patients or whatever the case. And it's hard for me to know where to send people, right? Because I can't just call places and be like, are you transphobes? Because nobody will say yes. Nobody will admit to that. But I do have questions like, do you provide gender affirming care? And I've had places be like, well, of course we do. And I'm like, okay, so you prescribe hormones? Oh, no, we don't do that. I'm like, oh, do you refer for surgery? Oh, no, we don't do that. I'm like, oh, interesting. Never mind. right. It doesn't. Yeah. And so I think people are like, know they should be doing this, but then there's fear around not actually, like around actually initiating and doing it and admitting that they don't actually do it. There's lots of places I've encountered where they claim they do it, and then I dig deeper and they absolutely do not. I won't say publicly who those people are, but and I think, I mean, part of our role as staff is providing training and education around like sexual and gender diversity in general, and I think that can be a good spark, because I mean, I don't know your presentation, but I definitely talk about it. I bring my trans healthcare soapbox everywhere I go. Like, we are going to talk about this, and so yeah, I mean, I presented to some family health teams and things as well, and I hope that helps spark things. But yeah, it can be challenging to get folks to think about often, I think. And something that, you know, out in Niagara, we've talked about ideas of like having, you know, like more directories around that and more resources available, and being able to be like, oh, this person had a good experience. Oh, you do actually provide gender affirming care. Great. And having those resources available. And so those things are in the works. I wouldn't say they're immediate, but yeah.
To have that information accessible, because it's not very accessible.
Yeah, it lives in like yours and my brain. Yeah. Right. Totally.
Were there any other questions online, or is that the only one at this point?
Cool.
Yeah, I was also thinking about Rainbow Health Ontario also offers a weekly mentorship call for not only, it's like, it could be primary care providers, but it could be like therapists or Social service, sort of like, it's pretty broad, but for people who had questions around like client care and case scenario sort of stuff. So there's that as well.
Yeah, so I can speak to this. And we've kind of already started talking about this. I think advocating for primary care providers to access education, such as what's offered through Rainbow Health Ontario. So Rainbow Health Ontario has a trans health knowledge base. I teach youth, and like, don't look up things on Reddit. I mean, you can, it's better than not, but don't trust everything you read on Reddit, but trust most things you read on the Rainbow Health Ontario trans health knowledge base. Like, that is a safer place to look for information. And that they also have the trans primary care guide, which, again, that provider that I mentioned who loved providing trans care, she had a binder that she followed. It was like, you can't mess up. It's all right here. And there's so much support available to me when this isn't clear. And that, Shoreborn and Rainbow Health Ontario are affiliated. I don't quite understand their relationship, but I want to say, like, same, but not. I think, like, Sherborne is the bigger body, and Rainbow Health Ontario is part of Sherborne. Okay. Has Sherborne and Rainbow Health Ontario have guidelines and protocols for gender affirming primary care with trans and non-binary patients. And again, is like a massive PDF document. I think it costs like $13-14 to download last time I looked.
You can just download.
I think you have to pay for it now.
Mm-hmm.
I think so.
Oh, I didn't know that.
Yeah.
That's nice.
It's still like not a lot of money. I will, if you find a doctor that wants it, I will buy it for them.
Yeah. I mean,
right?
You could do that.
Totally. Yeah, for sure. Right? I know. Good. If you're hearing this, I will buy
Celeste Turner.
I personally will buy you the guide. Maybe. Asterisk.
I didn't realize that. Oh my goodness.
I think you have to. Well, we've had it for so long, probably, right? And maybe out Niagara will buy it. No, I'm just kidding. Oh, that's true. Yeah. Hopefully, if you're a physician or nurse practitioner that makes decent money, you also could pay $15 and download it. Thanks, Carrie. Good point.
But I guess we're saying all of this stuff is available pretty easily online.
Very accessible.
I didn't know about this money thing, but
yeah, I think the guide costs $15 now. I mean, if you pay for a course, maybe you get it for free. And like I said, the courses, I think the most expensive one I've seen is $40. And the longest ones are like a day long. And within 4 courses of that, you would be pretty well equipped to provide trans affirming care. Like a week of your life and a couple $100 maximum. Yeah.
To offer like life-saving care.
Life-saving care. Yeah, totally.
So advocating, so this is just sort of speaking to like advocating for folks who work in human service, but I think everyone.
Yep.
That's why I wrote that. To become educated around, 2S LGBTQ plus health and wellness. So I don't know. I'm a big believer that I think everyone ought to be knowledgeable, and aware, because if this isn't impacting you directly, it's impacting someone you love and care about in your life. So
absolutely.
Yeah, that's just. So once again, Rainbow Health Ontario offers those awesome trainings, and then Niagara Falls Community Health Center and Quest are able to offer education sessions with that more sort of like local lens as well.
So. And our sessions are free. Yep. It's just a matter of booking them. Yep. And like literally for everyone. Like I always say, like everyone has pronouns, or maybe your pronouns are that you don't have pronouns, but like even that you understand that, right? Like everyone can understand these things. Everyone can talk about these things. It was awesome, even Debbie, to introduce yourself and be like pronouns, and people might not think like, oh, why would that matter in a library setting? Because Debbie has pronouns and you should know how to refer to Debbie, right? Like that's a great thing. And now Debbie has communicated to everyone that Debbie knows about pronouns, and you're safe to tell Debbie your pronouns back, which is so big and important. I was at a webinar the Alliance for Healthier Communities put on last week, and one of the doctors that I was co-presenting with mentioned that he was aware of somewhere where they call their receptionists like chief officers of first impressions or something, because it's true, right? Or like CEO of first impressions. Yeah, that that's experience starts right then around safe and affirming care. Yeah.
But whether it's like a phone call or like a stop in, right? That's your first interaction, and it's pretty important.
Yep.
Right?
Absolutely.
Extremely important.
Mhm.
So,
If I can do a little plug, Niagara Falls Community Health Center, I'm doing a training that's open to the public on Tuesday, June, like what month is it? Tuesday, June 28th. Of course it's June. In the afternoon, and that's free. And you just need to email me, and so I have your email address, and I'll send you the Zoom link. And it's free, and you can learn about pronouns and affirming and all that good stuff. Of course you can attend. Yeah, come on down. Oh, staff. Maybe you will.
Maybe I will. Maybe I will.
Cool. Do we have an online question? Yeah.
Down.
So Laura in the chat asks if there are existing strategies to recruit trans supportive healthcare professionals.
Can you read it one more time?
Yes. Are there existing strategies to recruit trans supportive healthcare professionals?
Recruit?
Mm-hmm.
Yeah, like how to get more trans supportive healthcare professionals in Niagara, presumably, but also elsewhere.
I know it's something my executive director thinks about. I know in hiring, it's a conversation that she now has with physicians and nurse practitioners when we're hiring. And she also very solidly believes that like trans care is healthcare and it should just be part of what everyone offers. So I can speak specifically to that. I know that that's something that's considered in hiring for Niagara Falls Community Health Center. Do you have?
Yeah, I mean, like same.
Yeah.
Request. And
Great.
I know that we're also like, we work with a lot of students or learners, you know, who are physicians who are wanting to, you know, focus on or at least have like a lot of knowledge around trans care. So we do offer that as well. I don't know if you folks do. Like students, learners
Mm-hmm.
who will actually work with, you know, our trans care providers.
That's great.
Who, I mean, when I say that, I mean, we all provide trans care, but we just have a few people in particular who do the bulk of it.
Designated. Yeah, sure. Do the majority.
Anyways, yeah.
Mhm,
That's a really good question, though.
Yeah, and I think that's also something to think about and take beyond. I mean, we're not going to have all the answers tonight, right? But I mean, the ideas I think are important, and what are the next steps? Yeah, like I've done presentations for like Med Plus students and students who like want to become physicians, and I definitely drag my trans care soapbox there. I'm like, I will fill your roster. Look at me making all these big promises. I will fill your roster if you learn trans care, right? Like,
I've done those too.
Have you? Yeah, good. Yeah, so educating folks, you know, in that context where we're guest speakers, it's not part of their curriculum. It's not something they're forced to learn, but somebody cool in their faculty was like, you should hear this. And we've gone and done those presentations, which is good.
And I've also done like dental, which is really cool. So dental diversity class. Like I thought that was kind of a unique one.
Mm-hmm.
Yeah.
Mm-hmm. But I'm not aware of any formal strategies, but again, I think those are things that can and should be coming down the line.
Yeah.
Mm-hmm.
Okay. Other thoughts were so we were talking about wait lists and how do we provide or increase support for individuals or folks who are on wait lists to access trans care. So what are we doing to offer support as a community, as community health centers?
Mm-hmm.
And I think that I wrote here, circles back to slide 14, which is this one. So advocating for primary care providers to access education.
Mm-hmm.
But how do we, in particular, trans youth who are under 16? So how are we supporting those youth? I think that's important that we give serious thought to that.
Mm-hmm.
And I guess both of our community health centers do offer group support for youth under 16.
Mm-hmm.
But I think there needs to be more.
Definitely.
And there always needs to be more.
Mm-hmm.
Yeah. And we also work together and partner and offer different events for youth. So opportunities for youth to connect with each other. We actually have one coming up on Tuesday.
Yeah.
So just like safe space for youth to connect and have fun.
Totally. Yeah, I think that's important that they might not be affirmed in their healthcare as quickly as they should be, but if they can be affirmed socially, if they can build their sense of community belonging, we know that the stronger someone's sense of community belonging is, then also the better their mental health is. yeah, that's important, and to provide opportunities for that. I'm 28, and when I, was 16 and under, like, I don't think there were any things happening. Maybe like one thing, and it was probably like you were putting it on, to be honest.
So there's a bit of an age difference.
Just a little. No, I'm just kidding. It's not a lot.
My grays are like shining across the live stream.
I have lots of grays, but I shave them off every 3 weeks. Is why you don't see them all. They're all here.
What
on both
events were
sides.
these? No, I'm so curious. But
I just remember seeing the advertisements as a young person and being like, thank goodness somebody does something. Because I definitely was not in a position where I felt safe to be able to do those things. And so I remember seeing things and being like, oh, there is something. Like, I'm not the only one. And I remember it being new. I remember it being a big deal, like, to me as like a little queer person. That wasn't disclosing that to anyone, but yeah, and that wasn't that long ago that there was such a difference in what's available, and now it's so fun for me to be able to tell people when people are like, "What groups are available?" I'm like, "Let me tell you about multiple groups that are available." Like, abundance is wonderful that they do exist, and it's not solving this healthcare piece, but is at least promoting their wellness in other ways.
Well, and there's also the Affirm group too. So,
Yeah.
So there are groups. Yeah.
Mm-hmm. Yeah. I think social support is what we can make happen fast and provide access to.
Support. Like,
yep.
Just making sure that kids have access in schools to safe supports too.
Mm-hmm.
That's so important. To at least one, safe adult they can connect with.
Yeah. Sarah, yeah. Online question?
We have another online question.
Great.
In order to learn how to keep facilitating more and more 2S LGBTQ healthcare in Niagara, I'm wondering if you can talk a little about how the programs you both facilitate in your jobs first came about, what went into making them happen, and how they might expand in the future.
Mm-hmm. Do you want to go first? Do you want me to go first?
Sure, I can. I'm gonna ramble.
It's okay.
So we were actually talking about this before. So Quest, our organization is pretty young. We started offering service in 2010. And basically, it was our board of directors who identified, we turned to the community to see where there are gaps in service, and serving the 2S LGBTQ plus community was like a major gap and still continues to be. But so that was identified as, one of the populations we wanted to serve among others. And then there was a program that already existed in the community, but that was focused for youth. And so this program was based on funding through grants, and the grants ended.
Yeah.
And so basically that program joined with Quest and became more.
Mm-hmm.
Yeah. So that's sort of like, in terms of the trans care, like that was already happening. So that's sort of our story. And there was a second question, sorry, to that. There's a second point. How do you
think, and like, where do they go? Like, where is it going from here?
I think like demand is increasing and continues to increase. And so I think that if we can get more funding to have more staffing, there will be more programming. I think there will be more programming.
Yeah. Yes. Just say it affirmingly and confidently.
There will be. There's going to be in the near future. We received some grant money, and we're gonna have like someone for a 0.6, which is 3 days. So to increase our youth programming. So that's pretty exciting. But
yeah.
Once again, that's a grant.
Yes. Right. Which
but
it's
wonderful. So I don't know. Yeah. So, and I was the person who was connected to that original group that came to Quest anyways.
Cool. Niagara Falls Community Health Center. I've been there for 5 years. When I started there, I was mostly like program facilitating, and then I shifted into more of like a youth outreach role. And so the youth outreach work I was doing was part of an Ontario Trillium Foundation grant, and our program, kind of priorities were food-based and mental health-based. We were running cooking programs and mental health programs, but encountering all these 2S LGBTQ plus youth in the meantime who, like, we were hearing the same stories, like needing support, and I think there's support in St. Catharines, but I can't get there, and all of these barriers upon barriers upon barriers that youth in Niagara Falls were experiencing. And I just approached my directors, and we were like, we keep seeing this need, and like it's a big gap, and they were like, do something about it. Like build it and they will come, or they won't, and then you don't need it. But yeah, so we built it. We started offering it was called like LGBTQ Youth Group, super creative name. And it was for ages 14, I think 14 to 18. And it was successful. Like we had kids coming. It was so, and week after week that it was coming, that it was happening, there were still youth coming every week. And so eventually that grant ended, and fortunately Niagara Falls Community Health Center was able to say, we can't stop doing this work, and created this position of LGBTQ2+ support coordinator. So it's part of my role now, is offering group programming. I've already seen it expand just in the time that I've been doing it. The first group we were running was for kids ages 14 to 18. And then I had so many calls from parents and guardians and families being like, my kid is 11 and is identifying this way. My kid is 12. My kid is 10. And the first couple of times I was like, ooh, sorry, I don't think there was anything till they're 13 or 14. And the third time I was like, can I call you back? And I talked to my director, who was like, build it and they will come, or they won't. And so we started offering, we changed the name to Queer Youth Collective. And we have, and still to this day, have a group for 14 to 18 year olds and 10 to 13 year olds. And in both groups, there are about 40 youth registered for both groups, about 80 youth in total. And they're drop-in, so it's always random who comes to group. It's not all 40 of them come every single time, but it's just always busy. There's always demand. And we're hearing more and more that there needs to be more support for families, for young folks, more events that are family oriented. So I'm sure it's going to grow more and more. And I would like to see more of that, specifically like programming for families, involve the parent guardians in the programming.
Or maybe like a concurrent, like a group where there's like a parent group and a youth group. So I think these things should be coming.
Yeah, definitely. It just keeps growing. And the only barrier is resources when it comes down to it. If we could just multiply each other like multiple times, there would be lots of programming. There would be so much. Yeah. Good question online. Mm-hmm.
And
we can talk about that one.
Yeah, I think this was our last sort of point or thought in terms of Accomplice, moving from an ally to Accomplice, is how do we increase support or services for folks who are increasingly marginalized, so such as BIPOC communities, sex workers, newcomers, seniors, migrant workers.
Mm-hmm.
There needs to be more. I don't know. I think there's layers to that.
So many.
Like I think we can talk about lived experience and the importance of having individuals connected to agencies who are representative of, these communities. I think that's a piece.
Yeah. The big like alarm bells in my brain are safety. How do we create more safety around this, right? That people's experiences might be like, yay, there are more programs for, queer and trans folks, but are they only serving white queer and trans folks? And what's going on with that? And is it safe for people who are Black, Indigenous, people of color, and what are the disparities and what's the difference and what's going on? And there definitely is. I don't have numbers to compare it to, but definitely are disparities in offering those services and accessibility of those services. And so how do we increase that?
How do we?
Yeah. And I think, part of Out Niagara's Community Strengths and Needs Assessment had sections specifically for QT BIPOC recommendations, and that I know Out Niagara is committed to continuing to do that work and bringing that forward. And again, comes down to resources and availability to do those things and do that work. And I think it's listening. I mean, I'm sitting here as a white person trying to say, how do we increase BIPOC safety? And I'm not always, the person to talk about that. I know it's important. I know it needs to happen, but my voice is not the voice that needs to be heard, other than make this a priority, right? But beyond that, it's not, don't listen to me about it.
Exactly, right?
Yeah.
As a cis queer woman, like
Right. Yeah.
So.
And I think safety and we need to engage with those communities in a safe way to understand what safety is and how do we build that. And because safety is accessibility. Mm-hmm.
So I'm thinking like maybe some of the work that Out Niagara,
Mm-hmm.
like in terms of the needs assessment, is going to address parts of it.
Mm-hmm.
We're all going to be
Yeah.
working together, right?
Yeah. Out Niagara has a service providers network also that is working on these. We'll be working on these recommendations and moving them forward. Both agencies and partners working group is what it's currently called. But yeah.
Do you have one more question?
Yeah.
Okay.
Great.
So it's not specific to Trans Health, but how do folks accessing intersex care in Niagara access health care? And do any doctors provide supports for intersex people in Niagara?
Yeah, great question. Mm-hmm. Intersex, I think, similar to this, question around BIPOC, I think we need to hear more from and create opportunities to hear from intersex folks. Even in the community strengths and needs assessment, the numbers of representation around intersex were quite small compared to other populations. And so again, I think that, there needs to be more education around providing that care. It's not something, again, that I'm aware of that folks learn about in school, other than like, this happens. And then they don't talk about it beyond that, right? And so, I know there are big movements in intersex advocacy. And again, it's that we need more people listening to those things and making that part of learning and part of practice, and making that accessible. So, do you have any things around Quest to add to that?
No, I don't think so.
Mm-hmm.
I just think it needs to start with like awareness and education first. Foremost.
Yeah. And I think, again, having access to a resource or something online, to be like, I used this provider and they were great. And also to be able to identify like, and I'm intersex and I had this really good experience is so important, because how do we make people hear other people's experiences and share that and have that be common knowledge? So I think that, I don't have any concrete solutions right now that I'm aware of people accessing that care in a good way, but yeah. Mm-hmm. Good question. Any other online questions? Yeah? Okay, great. Good. Awesome.
So if somebody doesn't speak English, how do they access your services?
So we would access it if it was a language that we weren't, like we have a couple of folks on Quest staff who are able to speak a couple of languages other than English, but we would access interpreter services.
Yeah.
For clients.
Same. Yeah. Interpreter services, RIO, RIO, which, but that's a whole other barrier. You still need to access NSCHC or Quest Community Health Center to know that RIO or interpreter services is an option. That's, a whole nother barrier there. I've had folks reach out from like Niagara Folk Arts, for example, like specifically looking for, a provider that speaks Spanish or a provider that speaks this language. And sometimes they're able to make connections. And, I think leaning on those resources too and knowing what is available that way is important. Mm-hmm.
And there's no cost for clients for that.
Yeah,
service.
no.
Yeah.
Mm-hmm. Mm-hmm.
Good question.
Yeah. I think that's all that we had for prompts, but if there are any other prompts, we're still happy to chat.
Yeah.
Incoming.
Yeah, so another question from Katie in the chat. We mentioned a bit earlier, I think, but just so we can get a repeat at the end.
Sure.
Is they'd like to know if you know of any support groups for parents of trans kids so they can best support and advocate for their kids.
Mm-hmm.
Yes.
That's a great question. So in Niagara, there is a PFLAG chapter. So that's a group for parents, not specific to trans youth, but I do happen to know that a lot of the folks who have been accessing this group over the last few years have been parents of trans youth.
Yeah, totally.
Or gender diverse youth. So yeah, they're a group that is currently meeting virtually. They meet at Quest pre-COVID, and I believe they're going to be starting that up again.
Oh, good.
So, yeah,
That's good.
at Quest in
Awesome.
person. So there's them. They're a wonderful group of volunteers. So
Yeah.
it's more peer support.
They have a good Facebook page with their contact info. I would recommend is look up PFLAG Niagara on Facebook, and you can email their chair Kim and get in touch and come to meetings and learn about that. And another resource that's available is Out Niagara has a Beyond the Rainbow resource syllabus. Out Niagara was getting a lot of questions like, why do you celebrate Pride in June? Why is it a rainbow? Like these kinds of questions. And so one of our amazing staff, Carrie, had put together this resource that you can find questions to. Yes, you're amazing. Don't shake your head no at me. I'll just keep saying it. Yeah, that there's exists on our website, on the Out Niagara website, Beyond the Rainbow resource syllabus that has answers to all kinds of questions there, including advocating for others and what that looks like. So that's a good resource that exists.
Like an awesome resource.
Yeah, Beyond the Rainbow resource syllabus is on Out Niagara's website. The community strengths and needs assessments on Out Niagara's website. Lots of good stuff there.
There's some
for
community
sure.
resources listed there as well.
Yeah, community resources. There's an events calendar on the Out Niagara website as well. Oh, the community fund. That's an important thing to talk about as well. Thanks. I'm like, I can't read from this far away.
I want to mention something else too.
Sure. The community fund is another thing that Out Niagara does. So Out Niagara, what the community fund is that people can donate money to the community fund, but also you can apply to the community fund for support with all kinds of different things. Folks who are part of Niagara's 2S LGBTQ plus community can apply. And then the board of directors will vote on if that's something that they can support. We get lots of requests, for example, for helping folks pay for gender affirming gear. We buy chest binders all the time, or new clothes or things, again, that are gender affirming and supporting individuals. We've paid for legal name change before. And actually, PFLAG Niagara has a My Name Change fund as well. Is that what you're going to say? Yeah, cool. So PFLAG has a My Name fund that also folks can access to help pay for legal name change. It's $137 to change your name, so not accessible to everyone to pay that fee. And so the community fund, again, it's on Out Niagara's website. I always tell folks, apply, and if you're not sure how to fill it out, just make sure your contact info is right, and Out Niagara will contact you and help you figure out what your request is and what that looks like and how to move forward. That's another thing that Out Niagara does. Just one more thought around supporting families and advocating too. I do meet with families. You do family support too, right?
Yep.
Yeah, more individualized, not in a peer-to-peer setting. Which I think PFLAG, and I'm not sure with COVID, but PFLAG used to also offer we can meet one-on-one or we can meet. They do.
Yeah. Coffee shop sort of meets.
Cool. That's good to know.
I don't know about with COVID. But
yeah, Zoom coffee meetings.
That's true.
Maybe. Yeah. But yeah, that's available as well. I do a lot of meetings where I have a lot of parent guardians will reach out to me and be like, I love my kid. They told me they're this. I don't even know what that word means. And I'm like, okay, so let's have a meeting and talk about that and understand, what support your youth needs. And then, a lot of times I also get parent guardians that reach out that are frustrated with their kids' experience, maybe at school or with their family doctor, with all kinds of things that they need someone to come and advocate and push for what their kid needs. So I do a lot of that stuff as well. Do you find that too?
I mean, I do too. Yeah. In terms of just parents reaching out, just wanting to know what's available, or maybe maybe they need some support or wanting some support themselves.
Yeah.
So
yeah.
Parent support, caregiver support.
Yeah. And I would say too, resources I think change often. And if you're not sure what's available, you can always reach out to Stephanie or to myself and we'll help you navigate what's available. If you don't remember PFLAG, you can reach out to us and we'll tell you PFLAG is a great resource, right? So there's that too. Anything else online or in person? Anyone?
Anyone here?
All right. Well, like I said, feel free to reach out to Stephanie and I. Our contact info is on the screen, and I'm sure it'll be available online after as well. with anything we can support you folks with. And I always tell people, even if it's something I can't support you with, I'll find you the right person or a better person who can support you with that thing. So
We refer to each other
all the time. Yeah, for sure. So yeah.
Okay. Yeah.
Do you want a mic?
So again, thank you so much for coming and presenting, and thank you for all the great questions online. Also, we were just reminded there was also a few links that were shared in the chat. Our friends at the library, we need to make sure that those are available. So afterwards, so just give them some time to upload those. So if you didn't quite catch those links in the chat, that's okay. Don't worry about it. They will be available through the Facebook page, and they'll be in the description of both YouTube and Facebook. So again, thank you for all the amazing information, great discussion. We do also have some, this is a problem, we have to handle both the mic and the gift. So of course, for all the hard work that you're doing, you obviously need some coffee to keep you energized. So
Steph and I literally email each other and go, hi, Steph will email me and be like, hi Celeste, I hope you're well caffeinated. Let's talk about this thing.
Well,
always. I'll be like, hi Steph, hope your coffee's still hot. How's your day?
Well, now you have a travel mug to keep it hot. You can get caffeine while you're doing your work.
It's true.
And to carry all your wonderful resources, you've got a bag to, for the activist on the go. So
What are they?
they do. Honoring collective love through radical resistance, which is kind of what we're trying to do.
That's amazing.
So, and also just for
Wow.
everybody who is watching or here in the audience, thank you so much for coming. And don't forget that, so next month, we will be meeting on the 27th of July again. So look out for our next Titillating Talks. Yay.